Great. So yeah, today I would like to show you how recoveriX works in the clinical routine in a normal. Sorry, 1 second. Here. Okay. So the objective of today is to show you how recoveriX works, and after this session, you would have a very clear idea how to set up the system and how to instruct the patient to do the therapy. So I have some slides to show you, and then after some explanations, we can go directly to the real test. So, okay, this is the recoveriX system. I'm sure, yeah, Christoph explained it before, but I want to remind you a bit. First of all, I have to say that this is a marketing picture, of course, because this is more or less a system, but it doesn't show all the components. For example, it's true, we have an EEG cap. Well, here we have the patient, and then we have the therapist next to the patient. So the patient is using this EEG cap. This EEG cap is not the real one because we have the 16 electrodes over the motor cortex. He is looking to the patient's monitor, where we have this avatar that is moving the hands in real time, linked to the EEG activity of the patient. And then we have one functional electrical stimulator. This is this also is not true because the real system has two electrical stimulators that are connected in each forearm, or in one arm and the other one in the leg. So as you can see here, the patient is also using these fast electrodes attached to the forearm, to receive the stimulation. But more or less, the idea of the system is this one. So the patient is seated in a chair and looking into the monitor, and is wearing the EEG cap, and also two functional electrical stimulators are delivering electricity to each limb. Okay. So these are the main components of the system. We have a computer, for sure, where the recoveriX software is installed. This computer is connected to the patient's monitor. We have also, in this patient's monitor, is displayed this avatar. Then we have these two GS TeamFest, these two electrical stimulators. And these electrical stimulators are connected to the electrodes that are attached on the forearm. This is the setup of the system. We have, well, here it's clearly separated the table of the patient and the table of the therapist, but this can be the same table. It's just for reasons to explain it better. We have decided to show it in two different tables, because we can see here clearly the space of the patient and also the space of the therapist. So let's go to the right side of the figure. We have the patient, which is seated on this chair. And this patient is, well, this diagram is showing the arms therapy, so left hand versus right hand. But we can also deliver the therapy to the foot, so to the ankle. In this case, we are treating the paralytic ankle against the healthy arm. So the diagram, it's a bit different, but essentially has the same components. So the patient is seated in this chair. In this case, we recommend to have this kind of chairs that you have support directly on the elbow, so the patient can be more relaxed and in more ergonomical position. So this patient is wearing this 16 EEG channels cap. This is one of the caps that we use in the therapy. As you can see here, we have all these 16 electrodes, and this device it's wireless. So the device is connected wireless to the computer. So we have here the base station attached to the computer. So I'm not sure if you can see wait. Yeah, well, I'm not sure. Here, the laser pointer. Sorry. So this is the EEG cap. We have the Nautilus attached on the occipital side. This Nautilus is connected by wireless to the base station. The base station is connected by USB to the computer. So the patient is looking to the patient's monitor. This patient's monitor is connected to the computer through this HDMI cable and also to the power supply. The computer is showing this avatar. The patient is also connected to the functional electrical stimulation in the right and in the left side. These functional electrical stimulators are connected to the computer by USB cable. And then these stimulators are connected to the FES electrodes, which are delivering the stimulation to the patient. These electrodes are from different sizes depending on the location of the stimulation. For example, for the arms, we have smaller surface in the electrodes, and for the legs, we have bigger electrodes. These are, for example, an example of the electrodes that we use for the leg therapy. Okay. And the last thing is the computer of the therapies, which is connected to at the same time to the power supply. So this is the general diagram. The first step that we do in the therapy is connect all the different parts of the system. So first of all, we place the EEG cap over the patient's head. I will explain you exactly how we are doing that, because this is important that the cap is correctly placed. This cannot be rotated. Otherwise, we are not recording the EEG signals that we want. So we want to cover all the motor cortex, right? So it's important that the head of the patient it's really in the same position, the cap on the head of the patient, and we can always have very good quality of the signal. So these electrodes needs a bit of conductive gel that are we put this gel using this syringe. Okay, so these electrodes have a small hole, right? So we introduce a bit the tip of the syringe without trying to scratch the scalp, just a bit deep, and then we inject a small portion of gel. For these 16 electrodes, we need around 2 milliliters or 2.5 milliliters of gel, so it's not really too much. I recommend you go gelling the different electrodes always in the same direction, keeping the same pattern, filling the electrodes. Otherwise, it's very easy to forget one electrode. The second step is to place the functional electrical stimulators. This may be a bit tricky at the beginning because if you never had contact with a real patient before. So for the upper extremity therapy, we are stimulating the extensor communis muscle, which is one of the main muscles that is responsible of this movement of the extension of the wrist, or wrist dorsiflexion. It's also called this movement. So we have to place the electrodes over the muscle belly, because if we go to the tendon, the stimulation can be painful. So that's something that we want to avoid, right? So we place the electrodes over the muscle belly, which is more or less in the first third of the muscle. And then a very easy way to find this muscle is to ask to the patient to do actively this movement in the healthy side, of course. And when the patient is doing this movement, you can notice if you put the fingers here that the muscle is popping out. Okay, so, but with a bit of practice, it's very easy to find the muscle. Maybe it's a bit tricky at the beginning. And for the ankle, we are stimulating the tibialis anterior muscle. This is very easy to find because it's just in the frontal side of the leg, below the knee. An important thing here is that every time that we set up the fez on the patient, we have to ask to the patient to do the movement and everything, but we have to always start with the healthy side. So because in stroke patients, sometimes the sensibility is also affected, and this hey Danny, so, and they are not used to get a stimulation, right? So if you stimulate for first time the paralytic arm, maybe they feel pain, or the feelings that they feel at this moment are uncomfortable. So it's better to show the stimulation feelings on the healthy side, and also it's also good to more or less know the range of stimulation that you have to deliver to the patient, also to the paralytic side. So this is a video that's showing how the how the fez is set up. I'm showing it in a video because I'm afraid that maybe here you cannot really see too much the procedure in detail. So first we have these electrodes. These electrodes, as I said, are connected to the functional electrical stimulator. Here the therapist is asking to the patient in the healthy side to do the wrist dorsiflexion. She's trying to locate the muscle belly. Seems that she found it. So we are using the same fez electrodes during some sessions, during 5 sessions. After 5 sessions, we recommend to trash the fez electrodes away and use a new pair. Because after some sessions, they are not sticky as at the beginning, and then you can maybe have some problems. Okay. So the stimulation protocol for the upper extremity, we are stimulating at the frequency of 50 Hertz. The pulse width is 300 milliseconds. And then we increase the amplitude of the current to each patient in each situation every day. So once these other parameters are fixed, we start increasing slowly the stimulation on this slide bar until we see the movement on the patient. Okay, the muscle gets activated by the stimulation, so the patient should not do the movement actively. We can see this nice movement where all the fingers are open, so are extended. Okay, this is a good movement. Sometimes can be that we place electrodes too much in the lateral side, and maybe you see that the movement of the hand it's going to the external side, or maybe to the medial side. So we have then to relocate the electrodes. So that's what the therapist is showing us in the video. The most important thing here is that patient is not feeling pain. So we have this movement threshold, and if we still continue increasing the current, we are going to the pain threshold. So we don't have to reach this threshold. We have to reach a very good quality on the movement, but without pain. So at the beginning, this can be tricky. because if it's the first time that you are placing the electrodes, maybe you are not very confident in yourself or whatever. It's no problem because it's totally safe. But at the beginning, maybe you need more time. But after some sessions of training, you can do it really quick. Probably one question that you would have is how much time you need to set up the whole system before you start the session. I have to say that if you are a bit experienced on that, which is not really difficult, the time that you need for the setup, it's less than 5 minutes in total for the EEG and for the CAS. Okay, so this is the recoveriX paradigm. This is how the system is interacting to the patient. So the patient is seated on this position, right? And he's receiving orders from the system. Each order is a motor imagination task, as Christoph explained before. So we ask the patient to imagine the movement, not really doing it, because then we can find these activation patterns in the brain, and then we can know if the patient is activating or not the motor cortex, and therefore we are doing the stimulation or not based on the activity, right? So each motor imagination task lasts for 8 seconds. So that's what we have in this plot. So 8 seconds, this is the horizontal line is the time in seconds. At the beginning, we have a sound that is saying that a new order is coming. It's a small beep. Then we have 2 seconds of resting. We use these 2 seconds as a reference. So patients should do nothing, just resting, looking focused on the screen, looking to the monitor, but not actively or mentally doing anything, just resting. And then in the second 2, we have the cue showing to which side the patient should imagine the movement. So let's say imagine that the system is delivering the right cue. So in this second 2, you would see in the screen the right cue on the pointing to the right hand, and also there is a voice telling you in your mother tongue language which is the right or the left side you have to imagine. So in this case, you would listen an order saying right. After the second 2, the patient should start doing this motor imagination task. And between the second 3.5 to the second 8, the feedback is activated in real time. So the most important thing now is what exactly means imagine the movement. So it's very difficult to explain this concept to a patient that maybe lost this function of the upper or lower extremity some years ago, right? Or then maybe in the case of stroke patients, in the case of MS patients, maybe they don't lose the function, but they don't have a normal function on the limbs, right? So what exactly means this motor imagination? Imagine the movement. So it's very difficult, but I always try to put the same example. I try to explain the patient, imagine that you have a bell just over your hand, or a ball or something that you have to touch, and you have to imagine that your hand is raising and touching this bell or this ball or this candy, whatever you like to have here, right? Just imagining the movement without moving the forearm. Just imagine that your hand, only the hand is raising and touching this object that you have over the hand, maybe a bell. This very simple strategy usually works to explain to the patient what they have to imagine. And the second question is, how much important is the patient concentration? I will have to say that the patient concentration is the measure. It's super important. Maybe more than 50% of the therapy success depends on patient concentration, because if the patient is not really concentrated on the therapy during all the session, he is not activating the movement in his brain. He's not doing the motor imagination, right? So in case that he's not doing the motor imagination, the system is not delivering the feedback, because don't forget that the feedback is directly related to the motor activity. So if the patient is not activating if the patient is not doing the imagination of the movement, then the system is not activating the feedback, right? So if you want to have dosage of treatment dosage, then you have to be concentrated. Otherwise, you don't get it. And the third question is how much important is the patient motivation? So we know the professionals in the rehabilitation world, we know that the rehabilitation usually takes a long period on patient's life. Sometimes it's for the rest of the patient's life. So usually after the stroke or after the patient diagnosis, let's say MS or stroke, just after that, the patient is very motivated, but after some months, the motivation is decreasing and decreasing. And especially when they see that they cannot recover all the functions that they had previously, right? So that's one of the reasons why the treatment adherence is getting lost over the time, talking about rehabilitation. So in general, our patients are very motivated because when they see this EEG cap with all these cables and they see these fancy monitors and these beautiful therapists, they usually get motivated again. But can happen that we have a patient that is not motivated. So we have to work on that, right? So we have to explain the patient that they have to be motivated on the therapy. They have to be concentrated, trying to find a new strategy to imagine the movement, to control the BCI system. They have also to do work at home. They have to. It's not something that you can get here for 1 hour and then you forget about rehabilitation the rest of the day. It's something that you have to be kind of self-motivated the whole day to try to implement the improvements that you get on therapy in your daily living activities, right? So we recommend to explain the instructions, instruct the patient every day. So it doesn't matter if this is the session 25, the patient should receive always the instruction about what is imagination of the movement. Also remember how much important is to be focused on the exercise and use the pause times on the session to motivate the patient. Okay. So this is this diagram tries to show how is the session composed. So one session is composed by 3 runs. Each run is a series of 80 repetitions or 80 trials. So always the first run is in calibration mode. Each run takes 15 minutes more or less, a bit less, but yeah, just a bit. So let's say that the first run takes 15 minutes. So the first 15 minutes of the therapy of each day are used to calibrate the system, which is the difference between the calibration and non-calibration mode. So in the calibration mode, the system is delivering the feedback. So the avatar is moving and the face is activated always, not related to the patient's performance. So maybe the patient is looking through the window, but in the calibration mode, the face devices are always activated, right? So we recalibrate every day the system to adapt the classifier of the recoveriX software to the new changes that patient has in the brain. So if we assume that the patient is doing neuroplasticity every day, so we have to assume that the brain works different every day, right? And also the cap position is also sometimes changing a bit, or the amount of gel on each electrode can be a bit different. So for all these minor things, we decided to adjust every day, recalibrate again every day the classifier. So if the patient is doing the calibration good, so this means that the patient is concentrated on the calibration run, then we go to the second run in training mode. This training mode is what we explained before. The system is only activating the feedback devices if the patient is doing good the motor imagination task on the brain. Okay. After the second run, we go to the third. So this means that after one session, the patient had to do around 240 trials, 240 motor imagery exercise for each in both hands. So this means 120 in the right side and 120 in the left side. So in each trial we have 40 trials. In each run, sorry, we have 40 trials for the left hand and 40 trials for the right hand, and they are they are in a pseudo random sequence. So this means that one session lasts for 45 minutes plus 5 minutes of setup. Every day after every session, the system is giving you the motor imagery accuracy. This is a number that ranges from 0 to 100. It's a percentage that explains more or less how good the classifier can differentiate between the left imagination and the right. So this means it's a value that can tell you more or less how the patient can control the system, how good the patient can control the system, and therefore how good the patient can activate the left or the right motor cortex. So at the beginning, maybe the patient needs some time to learn how to activate the movement in his brain, because you have to remember that maybe the patient had the stroke maybe 10 years ago. So they have to get used again to try to move the paralytic hand. And maybe the first sessions, the motor imagery accuracy is a bit low, but we expect that during the treatment, during these 25 sessions, the motor imagery accuracy it's going up and up, right? So this is kind of the motor learning process. We are teaching the patient how to activate again the motor cortex, and we expect that the motor imagination accuracy is also going up, like in this figure. This is a real patient plot of the motor imagery accuracy during these 25 sessions. So once we start the recoveriX software, we go to this screen. This is the patient selection window. So you have to select the patient in case that you have the patient already in the database. Then you go to this main screen. Here it shows the previous sessions. In this case, well, we have here at the top of the screen, we have the ERD and ERS plots that Christoph explained before. So this shows, again, the activation and the activation patterns of the motor cortex during the motor imagination in the right side and also in the left side. So these ERD plots have to be read in horizontal, right? Then we have the CSP plots during the right imagination and the left imagination. In the middle part of the screen, we have this plot. This plot shows the motor imagination accuracy of each hand during one trial. So we have the horizontal line, it's showing the time. We have 8 seconds. So after seconds 2, we said that we deliver the cue to the patient, and we have to tell the patient which side he have to do the motor imagination, right? So he have to process this information that the system is giving, and maybe 1 second or 1 second and a half, he can voluntarily do this motor imagination, right? So the accuracy of the movement of the motor imagery accuracy is going up, right? And it's important the patient can keep the concentration until the second 8. And in the lower part, we have the historical of the patient. For example, this patient only come 1 time before, right? So here we have the virtual reality activation button and the FES calibration button. This is the FES setup window. As I explained you, the frequency, we always take 50 Hertz. The pulse width for the upper extremity is 300 milliseconds, for the lower extremity is 400. And then we adjust the current for each patient. Then we go again to the main window, and we can start the session. This is the the user interface that shows that is shown in the therapist monitor, in the therapist computer, right? So we have here 16 EEG lines. Then we have the quality map on the right side. So as you can see here, the electrodes, each electrode has a name. As Christoph explained before, we have this 1020 international system for EEG. So each electrode is having a specific location. So this means the letters and the numbers that are over this brain. So when the signal quality is good, we can see this line with these small waves, and all these electrodes look like that in green color. But if one electrode is not having enough gel, or maybe, yeah, don't know, whatever, maybe it's broken or whatever, then the electrode is marked in yellow or in red. After some sessions, after some trials, sorry, we can calculate the ERD and ERS maps to show the patient concentration, to show how the patient is activating the motor cortex. So this video shows how, in theory, it's not working. Wait. How the whole procedure of starting the system is working. So we have this icon in the desktop. We click on here. Then if it's the first time that you are using the system, then you also need to enter the physician information, who is the responsible of delivering the therapy. Then we can add the patient details. You also have to select the language. And we add the epoch information. It's a short description. And then we are able to start the therapy, right? So start the virtual reality. We adjust the current parameters. And then we can go to the session. So and then the only part that it's required is just to start the session in this start play button, right? So let's go to the real session. We have here Danny. He's one of recoveriX software developers. So hi, Danny. So we ask him to sit on this chair. Here we have the patient monitor, and in the other side is the therapist computer. So you can put the EEG cap. So the EEG cap contains 16 electrodes, as I said before, and they are located in 3 layers, more or less.
Mark,
yep.
Sorry to interrupt. Could you maybe stop the presentation while you're doing something on the camera, because then the image is just bigger.
Mm-hmm. Wait.
Looks good.
Okay. No. So it's important that the central line of electrodes, it's more or less over the ear. And also we have this special electrode in the front, which is in yellow color. I think that you cannot see it from the distance, but the electrode that we have in the front is having a label in yellow. So this electrode should more or less be arranged in the line of the nose, okay? So if you have these 2 things, if you consider these 2 things, then the cap will be correctly placed. The central line of electrodes over the ear, so over here, and the yellow electrode over the nose, okay? We can. Okay, this is the Nautilus amplifier that it's plugged on the electrode cables. So here we have the electrodes for the hand therapy. They are smaller than the ones that I showed you before because the muscle that we are trying to stimulate, it's smaller anatomically. So if the patient have a lot of hair in the forearms, sometimes we need to remove this hair, but it's important to clean the surface, the skin surface, before we put the electrodes with a bit of alcohol. Can you please raise your hand? Okay, exactly. So we can notice clearly that here is the muscle belly. The muscle belly is in general over this side. So I don't recommend to put the electrodes below that point because this can be painful, as I said before. So once the fast electrodes are connected, we can start calibrating the stimulation, the therapist computer. So we start always on the healthy side. Let's imagine that the healthy side in this case is the left side. So we start the stimulation and we can increase the current slightly until he shows this extend your fingers, these fingers extended, okay? In case that the electrodes are not correctly placed, we can readjust them, right? Until we see clearly this movement, okay? We do the same in the right side. Okay, so here, for example, we have 9 milliamperes in each hand. So the avatar is already displayed here, so we can start the session. Not sure, well, I will try to move a bit my computer. Well, it's really hard to see now. I want to show you the EEG lines one second. Maybe now it's better. I tried to do the presentation before too, and the daylight was different. So, okay. So we have to gel now the EEG cap. For gelling it, we always start with the yellow electrode we have in the front, the ground. And also we have a earlobe electrode that should be placed in the ear. We put also a bit of gel here. And then we start always in the same order. Filling with a bit of gel in each electrode, right? So this method works for everybody. Doesn't matter if you have long hair or what. Maybe you need more gel if you have a lot of hair, but in general, it's working fine, very easy way. So I'm not sure if you can see now the EEG waves, but they are getting flatter, showing these small waves that I was showing you before in the presentation. If we want to really check that the signals that we are getting is EEG, we can do two tests. The first one is to ask the patient to close his eyes, and we can see in the EEG how the alpha waves appear. The second thing that we can ask him is to move his mouth, this movement, and then we can see these artifacts on the screen. Once the signal gets stable, then we can click on the play button, and you can hear the sound. So it's in Spanish, is his mother tongue. So system said left, and then the second note, there is a voice, there is a sound says relax, right? Now again left, and his hands are moving according to that, right? So the session already started, and the patient should be concentrated, focused on the therapy. So he should be focused on this instruction that he's receiving. So derecha, izquierda, left, and right. So I think that you have some questions in the chat. So Reza is asking which part of the leg electrodes are connected to. So we connect the electrodes we place the electrodes over the tibialis anterior muscle, so the muscle that we have just below the knee in the frontal side of the leg. But this is essentially the recoveriX treatment. So we gel the EEG cap, we place the FES electrodes, we calibrate the FES stimulation, and we can start. It's recommended during the session that patient needs to be more focused. It's recommended that we don't talk next to the patient. We don't walk around.
Mark, at the moment we are just seeing Dani. Do you also want to show the screen a little bit?
I will try to move my computer. I'm not sure how much we'll be able to show. Before I was doing some tests, and the computer of the therapist was correctly shown. Now the light changed a bit. So wait. Okay, now right?
Now we can see it. So here you can see 16 EEG channels.
Exactly.
The data looks nice. And on the right-hand side, you can see a brain overlaid by the 16 electrodes. But Mark, go ahead with the explanation.
So as you can see here, all the electrodes are in green color. I will now try to do some, I will move some electrodes, and then you can see how the signal gets noisy and how the quality map that we have in this side gets in different colors. You see? For example, I'm going to touch this electrode, the FCZ. Once the signal gets stable, the FCZ, the one that we have in the front. And we can see this line, which is marked now in, we have here the artifact, and then get stable again very quick. Yep. In the lower part, we have these small balls, these small cycles. We have 80 cycles in total in all this lower part of the screen. So each cycle represents one motor imagination task, one trial. So when a new trial is going on, then the cycle gets smaller. So you can have here more or less an idea how many trials the patient did in this run and how many trials are missing. More or less in the middle of the run, so when we have 40 trials accomplished, the system gives you a chance to do a pause of up to 2 minutes. Then you can use this pause to motivate the patient, or give more instructions to the patient, or maybe give him some water if he's getting sleep. But more or less, this is how it works. Okay. In this side of the screen, you see the next order coming. So, for example, now it's left. Now right order is coming. Okay. And we can see the first ERD plots. We have enough data now to calculate the ERD plots that are.
Mark, Ari is asking what's the program announcement actually saying that we can hear, but it's Spanish, so people don't understand.
In Spanish, yeah, it's left or right. So derecha means right, and left means izquierda means left. So we skip the pause period. We can see here the ERDs and ERS plots. So what we expect to see here, as I said before, these plots should be treated in horizontal. So we have here the C3 activity and the C4 activity. So what we expect, if the patient is concentrated on the session and he's doing this motor imagination, during the motor imagination, we should expect cold colors, so blue, green, light blue colors on the hemisphere that is actually doing the movement. So if we know that the C3 is placed over the left hemisphere, we expect that the C3 shows more blue color, and in the C4 electrode, which is in the right hemisphere during the right imagination, we expect that this cortex is not activated, that this cortex is kind of silent. In this silent period, in this deactivation period, the ERD shows more hot colors like red or reddish, orange, right? So this is how the ERD-RS plots should be read, but in a very simple way. They are more difficult, but just to give you an idea, right? At the same time that the system is saying left and right, we can see these green arrows appearing on the screen. Derecha, right. So we have this green. Now, in order for the left, you can see this arrow. So the patient can hear the voice saying left or right, and also can see in the screen the arrow pointing to the left or to the right. So we always see this positive feedback going on because we are in calibration mode. We are calibrating the system. But more or less we are disturbing him a lot because we are talking next to him. He tries to be concentrated, but yeah, I think that it's a hard task for him now. And we are also, well, I'm moving around him, so I'm creating some artifacts because I'm touching his head sometimes. And you can see these artifacts on the signal. That's why I say that during the session, the therapy should be really silent next to the patient, looking at the screen, checking that the quality of the signal is okay, but not disturbing the patient, not talking and not moving around. Just the opposite of what I'm doing now. Yeah, there are just few trials more to finish the run. And then after this first run is finished, the computer processes the data and tells you the motor imagination accuracy for this run. As I said before, each session is composed by 3 runs. So the motor imagination accuracy is calculated after each run, so and takes the data from the previous run. So every time that we calculate the motor imagery accuracy on the session, it's getting more precise because we have more data. Okay. Only 6 trials are missing to finish the session. Sorry, the run. Also, the ERS plots are recalculated every time, including more trials, then they get more precise. The last one, izquierda, left. You can see it here. And now it's processing. So how do you feel, Nani? Fine? Okay. Okay, he says now that the stimulation in the left side is too weak, too low, so we have to increase it a bit. So in this view that the system is providing us, we can see here the motor imagination accuracy. In this case, is 64% because it's really low, but it's because I was all the time talking next to him. He said that he was paying attention to what I was saying. So now we can go to the training. So the system is already calibrated, so we can go to the training mode. In this training mode, the feedback will be only delivered if the patient is activating well the movement in his brain. So then you don't move the hands, just let the stimulation activate the movement. Okay, so I will put my computer here in a general view. Sorry. So system now set left and nothing happens because he is not concentrated on the movement. Come on, Danny. You're really bad. So all the time the system is saying again left and the feedback is off because yeah, he's not enough concentrated. Now it's okay. you see during some seconds the right hand was. Okay. Okay. I'm going to answer some questions that I see in the chat. Teresa is again asking, thank you for Mark for the setup presentation, great work. I'm relatively new to the concept of motor imagery. On your system results slide, based on which metric do you calculate and evaluate the accuracy of motor imagery? How do we estimate that? The accuracy that we are showing, that we are giving to the patient, is the accuracy of the classifier. So how would the classifier can detect if the EEG, based on the EEG data, if this was on the left class or in the right class. So we do a cross-section, validated accuracy. Not sure if there are more questions in the chat. Christoph, did you see it? Yeah,
no, in the chat, they're all answered in the chat.
Okay, perfect.
So thank you very much for the demo, Mark and Dani. Very nice done.
Okay, thank you. You too.
And